On World Obesity Day, campaigners are calling for action to try to tackle the increasing number of people who are severely overweight. There are now more than 1 billion people who are obese. The Lancet Medical Journal says numbers are growing faster than predicted. Back in 1999, there were about 226 million people classed as obese, but by 2022, that number had grown nearly fivefold. It's still a bigger problem among women. However, male obesity continues to rise at a faster rate than women, tripling since 1990. And obesity among children and teenagers has ballooned, 159 million in 2022 compared to 31 million in 1990. Obesity is expensive. People can be less productive or unable to work, while some need treatment. The WHO estimates that if numbers continue to rise, the global cost of obesity could reach $3 trillion per year by 2030, and 6 times more than that by 2060. Dr. Francesco Branca from the World Health Organization is one of the authors of the Lancet study. Thanks for coming on the programme. Doctor, why is the world getting fatter?
We have had a great change in food systems, a transformation that has made food which is high in energy, particularly fat and sugar, available and affordable to most world population around the clock. But also lifestyle changes with less physical labor and leisure time spent on sedentarily, as well as changes in sleeping pattern and a lot of stress.
Now, you co-authored this report in The Lancet. I mean, what concerns you most about the findings?
As you said in the introduction, the epidemic has been growing much quicker than we thought. And now these staggering numbers reach every country in the world. Very few countries in sub-Saharan Africa are still immune. But most low and middle income countries that could not afford the burden of obesity on their health systems are affected. And this is creating a health impact. We calculate that at least 5 million deaths every year are accounted for by obesity, as well as unsustainable burden on the economy and on development. 3% of gross domestic product will be cut because of obesity.
I want to talk to you a little bit more about that because, of course, there are the huge health risks associated with obesity and the pressures on healthcare systems. But as you say, it's an economic, it's a financial story too. So talk us through what the rise in obesity is costing.
So certainly the cost on the health system. People living with obesity are subjected much more to certain chronic diseases, particularly heart disease, type 2 diabetes, certain cancer. They suffer consequences on their quality of living. They have expensive problems on their skeleton. They don't sleep well, so they're also less able to work. So it's a health system cost, and as you know, health systems have been proven by the COVID epidemics, and they are very fragile. So that's of course a major cost. But then, you know, the inability of people to live healthy lives and be active at work, that is an impact. I mean, the impact on absence from work, for example, is something to be considered.
And just quickly, what would you like to see happening to reverse, to change this trend?
We have been making recommendations for the last 20 years, and these recommendations have been unheard. We need changes in our environment in the first place. It's not an individual responsibility. We cannot leave to the people living with obesity to change their lifestyle choices. We need to create supportive environment. We need to have food systems and food environment that are not pushing through marketing certain products, particularly foods and sugary drinks. We need to make them less appealing. We need to increase the cost, maybe through taxation of those foods. We also need to offer healthy foods in public institutions. We need to make schools more supportive of physical activity. We need to make the cities also able to support physical activity. And we need to have health systems who are able to diagnose the condition in time.
Dr. Francesco Branca from the World Health Organization, thank you.